Hi everybody, today we are going to talk about extrapyramidal system. Having spoken about the pyramidal system, that is the corticospinal tract and the cortico bulbar tract in length, we have to talk about the extrapyramidal system also. Because most of us know what is the pyramidal system and how to test the pyramidal system, what is the function of pyramidal system. But most often we don't look very deeply into the extrapyramidal system. If at all we look into it, we just know the names of the extrapyramidal system, from where they arises and where they ends. That is what maximum we know. But what is the function of the extrapyramidal system is not that much explored and not taught to the students. So I just wanted to tell these things and some clinical correlation as far as the extrapyramidal system is concerned. So the tract what we are going to take today is the Rubrospinal tract. So when I say Rubrospinal tract, I have mentioned the rubro in red color because this is something concerned with a structure which is red in color, which is nothing but the red nucleus. So the red nucleus is in the midbrain. We know about the other structures of the midbrain, the tectum, tegmentum. Along with that, you have the red nucleus as well. So the nucleus of this Rubrospinal tract is located in the red nucleus. So the upper motor neuron of red nucleus is located in the midbrain. Fine. So the first question is answered. The nucleus is located in the midbrain. Second question is, where does this gets inputs from? So here there is a difference between the pyramidal system and an extrapyramidal system. The pyramidal system starts directly from the cerebral cortex. Both the corticospinal and the cortico bulbar tract starts from the cerebral cortex. So cerebral cortex can invariably directly influence the spinal cord by means of the pyramidal system. But the extrapyramidal system do not arise from the cerebral cortex. So where they arise from? They arise from some of the nucleuses which are present in the basal ganglia or in the brainstem. They are influenced by the cerebellum and cerebrum, but okay. So how they are influencing the extrapyramidal system is what we are going to see. That is called as the inputs. This Rubrospinal tract receives inputs from the same side cerebral cortex and the opposite side cerebellum. This has to be remembered. That's why we called as a crossed cerebellar input to the Rubrospinal tract. So the cerebellum sends information, the opposite side cerebellum sends information to the Rubrospinal tract, and the same side cerebral cortex, the motor cortex, sends information to the Rubrospinal tract. So the second question is also answered. So where does the crossing over takes place? Why we always concerned about the crossing over? Then only we know if the nucleus is affected, whether the same side limbs will be affected or the opposite side will be affected. So in that way we should know whether where the tract crosses over. So here the Rubrospinal tract crosses over at the level of the midbrain, okay, and it remains on the lateral part of the pons medulla and also on the lateral part of the spinal cord. And where it ends, invariably it ends at the spinal cord, where it ends on the anterior horn cells of the spinal cord. And also it can influence the alpha motor neurons and the gamma motor neurons of the spinal cord. So the fourth question is also answered. Now where does the lower motor neuron for this tract located? It is located in the spinal cord. Got it? So here our LMN and UMN is well defined. For this Rubrospinal tract, the upper motor neuron is located in the red nucleus and the lower motor neuron is located in the anterior horn cells. Fine. So what are the influences? What it influences? So normally we have seen that pyramidal system influences the flexors of the body, irrespective of the upper limb or the lower limb. The extrapyramidal system actually influences the extensors of the body of upper limb and the lower limb. But Rubrospinal tract is the only exception out of all other extrapyramidal system. This is the only tract which influences the flexors of the upper limb and the lower limb. Not more on the lower limb, it is more on the upper limb. Lower limb, its influence is faded away. Okay, so this aspect of flexor influence of the rubrospinal tract is very, very important when it comes to the Babinski sign, and also in terms of the decerebrate and decorticate rigidity. I'll deal all these things later on, but just remember, rubrospinal tract is a very important tract which influences the flexors of the upper limb more than the lower limb, and very importantly, it inhibits the extensors of the body. That is very important. It facilitates the flexors and inhibits the extensors. So what it influences is also done. And one more thing I wanted to add here is it influences the distal extremity muscles, particularly in the elbow, wrist and the fingers, not on the shoulder. So it influences the wrist, elbow and finger muscles more compared to the proximal. Okay, then having said this, what is the function of the rubrospinal tract? It helps in determining how much force a muscle should generate, what is the velocity of movement needed in the joints, and also the direction of the movement. So very importantly, these three things are essential for fine motor control. So rubrospinal tract can be considered as a tract which is very essential for the upper limb fine motor activities. We normally say pyramidal tract is very important for the fine motor activities, but here one tract which is the extrapyramidal tract, which is going to help in the muscle force production and fine motor activity. So what happens when there is a dysfunction? Luckily so far the red nucleus is not isolatedly affected, or the rubrospinal tract is isolatedly affected, because it has blood supply which also supplies the surrounding areas and other structures. So far in human being, this rubrospinal tract is not being isolatedly affected. If at all it is affected, what might be the hypothetical situation that may result? It may result in the impairment of the upper limb hand function. Fine. So one important thing with rubrospinal tract I would like to tell you is this tract is well developed in human being compared to our ancestors, that is our the gorillas and the apes and the orangutans, because of which our hand function skills are much better than the animals. This might be correlated with the purpose for which the animals are using their upper limb and why for what we are using the upper limb. The animals predominantly use the upper limb to fetch their food substances and to climb the trees, not to manipulate things with their hand. But human beings do manipulation predominantly with the upper limb rather than using it for ambulation. So with this important tract, rubrospinal tract, is complete. Tomorrow I am coming up with one more extrapyramidal tract. Thank you so much. Keep in touch, educate others, spread the knowledge. Bye.